Prescribing a medication for pregnant women is a complex process. Before obstetricians and gynecologists decide which dose of which drug can best treat a condition without putting any harmful side effects on the mother and the baby, they consider the patient's age, general health, the number of months before delivery, tolerance for medications, and any other drugs the pregnant patient may be taking. Prescribing exercise on pregnant women has to be just as scientific and precise. The type, intensity, frequency, and duration of a dose of exercise are all critical. One person's healthy, vigorous workout could be hazardous to another. These dangers may be greater in pregnant women because they are more likely to have strains and other serious side effects for the would-be mother. However, if exercise will be implemented and carried out in a normal, average range, exercise will not have an effect on the overall condition of the pregnancy and especially on labor or delivery. Pregnancy. Quality prenatal care should be given to a mother during her pregnancy. She should be prepared for the normal delivery of a healthy baby. Complications should be prevented at all costs. All of these things are boiled down to the fact that a pregnant woman should be cared in such a way that she will not be compelled to do vigorous work, but should not also stay in bed and be inactive until she gives birth to her baby. Consequently, a pregnant woman's condition varies in relation to the growth and development of the baby inside her womb. Therefore, it is necessary that proper health guidance be provided by her physician during her visit. Moreover, it is important to keep the pregnant woman's life active in order to promote good health, not only for her but also for the baby. Most importantly, physical conditions like blood pressure, weight and health status is usually monitored during the pregnant woman's visit to her doctor. For this reason, it is significant to note that exercise can be the number one factor in order to keep these aspects in good condition. As the health experts contend, adequate physical and emotional information is needed by a pregnant woman to prepare herself for delivery. She needs practical health messages in keeping herself and the baby healthy. Hence, for mothers or would-be mothers who are not yet aware why they should exert some effort in engaging into moderate, normal exercise, here is a list of some of its benefits so that you will be able to understand the reason why pregnant women have to exercise regularly. 1. Science against fatigue. As muscle becomes fatigued, it produces less force to accomplish a task, like climbing the stairs, for example, or shoveling snow. More units of muscle must be called into play to back up the wearied muscles. The tired muscles are both less efficient and less effective. Hence, this will just put more strain on the pregnant woman because of the weight that is continuously adding up each day. That is why tired muscles will usually result to leg cramps or sore muscles. What every pregnant woman must know is that exercise improves the condition of the muscles and their ability to work longer without fatigue. 2. Reduce backaches. Even when you sit or stand, some muscles are working, and such relatively easy postures can tax some muscles and cause fatigue. The muscles of the lower back, for example, can be exhausted and worn out by the effort of keeping erect when a pregnant woman stands still for several hours. With exercise, a pregnant woman can correct this error by developing her posture. 3. Increase the amount of oxygen. Work and exercise rely on glucose, a substance produced by the body from complex carbohydrates and stored muscles and liver. The supply of glucose in the muscles determines and limits the duration of activity. Exercise depletes the glucose in the muscles and leads to tiredness. However, when glucose is depleted by strenuous activity, it is replaced in quantities greater than before, as if the body recognized the need to lay in a larger supply of fuel. Hence, oxidatio is essential for converting glucose to the energy that pregnant women need to wiggle a finger, flex a muscle, or practice the lungs and heart for some blowing action during normal delivery. These are just some of the many benefits exercise can bring to pregnant women. Besides, nothing is completely wrong for a pregnant woman doing some moderate exercises. The only important thing to remember is that before starting an exercise program, whether pregnant or not, it is best to consult your doctor. As they say, doctors know best.